That's very critical in Manitoba.
A shortage of more than 350 doctors in the province is putting pressure on physicians on the front line, and some medical professionals say the wait is not just isolated to doctors' offices and emergency rooms.
And every day, like 1 or 2 customers, they are calling and looking for the physicians.
Viran Patel is a pharmacist on Arlington in Winnipeg and says his patients are suffering as the province deals with a doctor shortage.
Most of the doctor, they are not staying over here. They are moving out of the province. And some of the customer, some of the patient, they are they cannot find the new doctor, because whatever the doctor over here, they are very booked. So they have to just go here and there, walk-in clinic and emergency care and lots of issues.
Patel helps when he can, but like walk-in clinics, pharmacists operate under restrictions when it comes to how they're able to help, which may result in patients getting less than thorough care through doctors. Access to certain medicines and specialists may also be off the table.
The problem is that the walk-in clinic doctor or emergency care, they are just taking care of your whatever your current situation. They are not your family doctor, so they don't have the history of your medication or medical history.
The extent of the shortage was detailed in a recent report by Doctors Manitoba, which found the province would need 359 more physicians to meet the Canadian average when it comes to physicians per 100,000 people.
Physicians in this province are experiencing high or very high levels of burnout. And this is a record high. It's a staggering number.
Chair of Doctors Manitoba and ER physician Dr. Christian Thompson says doctors in the province need help, with 51% reporting symptoms of burnout, resulting in many going without a doctor.
Right now, there are over 150,000 Manitobans who cannot find a family doctor. And there are many more who can't get in to see their primary care physician in a reasonable amount of time.
However, he says when those on the front line call for help, the call goes unanswered.
That is unacceptable. We cannot keep doing this dance. Something has to change. Things are critical right now.
The government of Manitoba has said in the past it's working to address gaps within the healthcare system, and recently announced a $12.5 million investment into an interdisciplinary health and community services simulation center at Red River College Polytechnic. Aimed at training more nurses and healthcare professionals for Manitoba, Health Minister Audrey Gordon called the investment a great day for Manitoba students and Manitoba's healthcare system.
This investment helps us to build for the future and provides quality training for students working towards careers in the health services. By helping these students to gain valuable skills and experience in a simulated, supportive learning environment where we are building our province's health human resource capacity.
Opposition NDP leader Wab Kinew says the government is failing to take the action needed to fix the province's healthcare system, saying when medical professionals like Christian Thompson speak out, the government should listen.
Things continue to get worse, and that is very concerning. And as we look ahead to winter, just anecdotally, we look at what's happening with friends and family right now. I think we should all be very concerned about our healthcare system.
Health Minister Gordon says the government will soon release more details on how it plans to address issues within the system, saying a preliminary draft of an action plan has already been developed. In Winnipeg, Morgan Majeski, City News.